Hey, good morning,
Good morning.
Dr. A.
Morning, Dr. Saylor.
Hector.
Good morning.
Good morning. Casey, how's it going?
Good.
All right. So we have a nice topic today, and this is fresh out of the office, actually. As you know, we try to do things that we see on a regular basis that may be of help to the public in general. And, we always say our patients that have done their research are our best patients. So we're looking for patients that are, interested in the content that has substance and things that you may learn from so you can avoid problems and have a healthier mouth. So this particular subject is a neat one to talk about. It has a lot of nuances to it, and it relies a lot on the discretion of the dentist to help you through it. And we're talking about
Cracked tooth syndrome.
yeah, cracked tooth syndrome. And, as you can imagine, you think about the word, what it conjures up, and you would think about a tooth splitting like a log.
Right.
Sometimes it does, right?
Sometimes it does, but this is a little more nuanced.
Most of the time it presents, well, why don't you talk about how
Yeah.
typically it would present?
Yeah, cracked tooth syndrome is something almost hidden. It's something that you won't really see, as the name would suggest that you would see a crack through the tooth. What we're talking about is more like a fracture,
Yeah.
a tiny crack that's propagating more from like the inside of the tooth. So it's hard to see this type of crack that we're talking about today.
Yes, and if it's a hairline crack that is kind of new, it's almost invisible. Sometimes that crack can get stained.
Right? It makes it a little bit more visible when it's stained like that, whether from food or anything like that. But it's something that you might see on the surface of the tooth. And so for us as the dentist, we are trying to properly diagnose if you have cracked tooth syndrome.
So how would the patient know that they have a cracked tooth?
If you have cracked tooth syndrome with cracked tooth, you're going to know something is wrong. You're typically going to have pain, discomfort. And so this type of
All the time, or?
It happens when you're chewing mostly. And so it's a type of discomfort when you're chewing on something hard or even something sticky, you bite down.
Uh-huh.
And typically it's actually the moment you release that you feel the discomfort.
I liken it to if you have a splinter in your toe or a piece of glass in your finger and you think it's gone and then it's still there, right?
Yeah. You can
It's
find
like
that.
real fast and sharp like that. And can it be any other symptoms?
You can have cold sensitivity as well. Some sort of, typically it's as bad as 10 out of 10 type of sensitivity or discomfort.
And it can go from just the crack, the pain on biting, to then some cold sensitivity, and then progress to the point where it aches.
Yeah, it could be a dull ache.
And these are signs of progression.
Absolutely.
Now, can you see a tooth that is developing a crack but not have symptoms?
Yeah.
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 Those are the tricky ones. Well, what do you do in these scenarios?
In these scenarios, so let's go.
Let's take the one that is starting to crack
Yeah,
but doesn't have pain.
that's right. So something that doesn't have pain, it's a crack that we might be able to identify with our eyes at your hygiene visit, at your checkup at the dentist. And so we might be seeing that tiny little fracture line or stained line within the tooth that we're like, okay, this is on our radar. This is something we should look out for. But you're not saying anything is cold sensitive and you're not having pain to chew.
Not having any symptoms whatsoever.
And so we'll look at that and say, okay, something's going on with this tooth. It seems like there's a crack propagating through this tooth. And we do clinical judgments in terms of, okay, what's the next step for a tooth like this?
Yes.
And it's going to be one or two things. So for my thought process with it, I look at a tooth that has that crack starting and you don't have any symptoms, and I say, maybe we can monitor this. Keep it on our radar, put it on our watch list, and keep an eye on it to make sure that that crack doesn't progress.
Okay.
And now there's another option, and this kind of goes with your experience, Dr. Saylor,
Uh-huh.
of seeing a crack like that and having a history and knowing, will that crack progress based off your experience?
Exactly. Yeah. And so what I would add to that is when I see a crack like that in a tooth, I'm thinking, has this patient had another tooth that has developed a crack that required a root canal or even loss? I'm not going to take any chances on that patient. Or if I see a cause and effect relationship, I can see what's causing the crack, which may not have been a particular instance of biting down on something too hard. It may have been the way the top and bottom teeth come together, and the bottom tooth may be wedging the top tooth apart. And in those cases, I would be preemptive. And I always have the relationship with my patients that I'm always going to do what's in their best interest and look them square in the eyes and say, I think it's in your best interest to cover this tooth. And the good thing is a patient that's been with us for a while, they say, I trust you, which is always, I never take that for granted. And what do I tell them? I trust you as well, right?
Yeah.
Which is a weird statement, but it's true.
You do.
I trust you as well. In other words, you're not abdicating total responsibility to me, and we're working on this together.
Yeah, it's a team effort, and it's a relationship that you've built over the years with that patient, and
Yes.
it is a decision you're making based off knowing the patient really
Right.
well, knowing their history, knowing where are their risks. Do they have a strong bite?
Yes.
Do they clench and grind their teeth? Things like that.
Do
when you
they
make that
chew
decision.
things they shouldn't with their teeth? And I think we'll go more into that.
We
But
will.
to stay on the same topic, we started with the tooth that doesn't have symptoms but starting to crack, in the judgment call on to monitor it, to be preemptive and do like a BioClear or to crown the tooth. So what if they do have symptoms? If they have the classic cracked tooth syndrome, not necessarily cold sensitivity, but ow, that hurt.
Right. They find that right spot that you bite on and it makes you jump.
Right. Well, what do you do then?
So we would talk about crowning the tooth and putting some protection over that tooth to prevent that crack from extending.
But doctor, this tooth doesn't even have a filling. You're going to crown my tooth?
Yeah, it's something about the fact that that cracked tooth has progressed far enough where it's starting to get closer to that pulp, which is the center of that tooth.
And you know that because they have discomfort.
They're having that discomfort at this point where it's propagated enough. So
Right.
it's thinking about that extent of this cracked tooth. And it needs that coverage.
So if we crown the tooth, and I'm being a patient, it's not going to crack, right? And I'm going to be okay. The pain's going to go away.
Not necessarily.
Oh.
It's the nuance with the cracked tooth syndrome.
Okay.
We are trying to prevent any further propagation of that crack. And we're
Yes.
trying to control the symptoms. We're trying to get you out of discomfort with the crown. But it's something that over time you can still get some more symptoms. And then we have to talk about, okay, what do we do at that point?
Okay.
And sometimes we can crown a tooth to try to protect it with cracked tooth syndrome, but it might need a root canal.
Okay.
And that
Shouldn't you
is-
just do it in the beginning?
That is the decision we have with the patient, which is why it's always we're doing what's in the best interest of the patient and having the discussion of where or what they would like to do or what we recommend.
Yes. And if I could add one more layer to that, I mean, part of that decision too is I tell the patient, let me do a little bit of investigation. What I'm going to do is I'm going to start preparing this tooth for the crown. And I can tell you, if I see this crack goes deeper than I thought, if it goes further than I thought across the tooth, then I may say, hey, this is a good time to go ahead and do the root canal while we have you numb, while we have you in the chair, based on what I'm seeing. And if you would like, I can kind of show you with some photographs what I'm seeing. And again, it comes down to trust. It comes down to discretion and operator experience.
That's right. And it's part of that is the investigation of seeing how far that crack goes down and deciding if it is time to do the root canal. Now, let's say we don't, and we put a crown on that tooth, and later some symptoms come up, and typically that's going to be some cold sensitivity.
Yes.
We can do the root canal after the crown's been placed.
But the good thing is you've already stopped the propagation of the crack. So I always tell the patient, we've been able to save the tooth. I just don't know if we can save the nerve.
Mm-hmm.
And then if you have to go in later, you can put a small hole through the top of that, take the nerve out, and it should be okay.
Yeah.
And I say should be okay because the problem is sometimes you can lose these teeth down the road. And we try to be as transparent as we can. Again, we're trying our best to save the tooth. And have we seen these go bad 5, 6, 10, 15 years down the road? Yes. I have one. Cracked, hurts every now and then, even though it's crown, if I bite a certain way. Still have the tooth, hasn't had a root canal yet. I know it's a possibility, but I've gotten 30 years out of it so far.
Mm-hmm.
So 30 years of use is not bad.
Yeah, that's valuable. Absolutely. You try to extend the life of that tooth as much as we can. And when we see it's time to shift gears, then we know, and we've had this discussion already about this is a guarded tooth. This is a tooth we're always going to be watching.
Yes, and the next level of that would be if you say, okay, not only am I going to crown the tooth, but I decided to do the root canal in the tooth. There are times when I'm starting the root canal and I look at it and I go, this is not going to work.
Mm-hmm.
How do you know that?
You can actually visualize that crack and it's going deeper into that root system.
Inside of the canal.
Mm-hmm.
If it's going inside of the canal,
yeah,
I've found that don't even waste your money on that. Again, you have no idea. It's again, the relationship with your doctor of the nuances that we're talking about, how to use your time and money and emotional investment well.
Yeah, that's right. And it would be something where we would tell you in that moment, hey, that crack is going into the canal closer to that nerve. It's going to be more in your best interest to have this tooth taken.
Yeah, and it kills us to have to do that. And then we, at that point, it's better to use something more predictable.
Yeah, like an implant.
Like an implant, right. So it's a good point now to transition as to how can I avoid a cracked tooth?
Yeah.
I know Casey wants to know. She's worried about all these things, although her teeth are perfect.
In the sense of avoiding a cracked tooth, one of the first things that we think of is what are you chewing and what are you deciding to eat with those back teeth? And so hard nuts, pork rinds,
corn nuts,
yeah,
grape nuts.
Yeah,
you don't see many grape nuts around anymore, but
you want to be careful with
people
what
my
you decide
age know
to
what
eat.
they are. Yes.
Yeah, I don't.
You don't know that one.
No.
Oh, they should be against the law, right? I mean, yes. If you're chewing something, I think about it all the time. I think about my patients out there, and I'll be chewing something. I'm like, bacon, right? Sometimes bacon's a big one. It's like some of this bacon, you get to the real hard part, and you're like, I hope my tooth makes it through this. You don't even want to chance it, right?
Yeah.
It's like,
if you're worried about it, just don't do it. Don't chew on that
yeah,
part.
and it's so funny to me because a lot of times a patient will come in, the wife will be, I told my husband not to cook this, and I ate it, and now my tooth is broken. They blame the husband, right? Because women, in general, it's like they're more cautious, right? And I see, some of my guy patients, it's like they're chewing through something like they're trying to kill it. You got to be careful, when you're eating these things. If you're coming across a lot of resistance that you're having to bear down on, especially depending on if you have a lot of dentistry in there, heed some caution.
Absolutely, yeah.
And by all means, don't chew ice. I see people mewing on ice, and I'm like, that's a risky activity. That's like skiing on a black slope through the trees, right? You're going to get hit. Don't do that. So that's one thing.
That's one thing.
Watch what you're eating.
Yeah.
What's another thing?
Well, it depends on the load that some of your teeth are taking. Let's say you're missing a few teeth in your mouth, and now you're compensating your chewing and your biting forces on fewer teeth.
Yes.
So those teeth are taking on more of a load.
For sure.
And what you can do in that case is try to get some pillars of strength back there.
Right. It's what we talk about all the time, where I will see somebody and they're like, yeah, I've got to get a tooth taken out, but it's a back tooth and it doesn't show. That's common. And again, patients that have been with us for a while know Those are your workers.
Right.
Those are the supporting walls. It's like you're going to pay the price. You take your 6-year molar out, the tooth behind it is going to take, let's say that 500 pounds of pressure, that back tooth that's already being overloaded is going to take on that load. And so is the little tooth in front of it, the premolar. So you're not getting away with anything. And you can still see it too.
Yeah, most of the time.
How about, what's another thing? Aside from the missing tooth.
Aside from missing teeth, if you are a clencher and a grinder, and that's some key words that a lot of people might say, oh, I clench my teeth.
Yes.
And so that is, and it typically goes with somebody with strong masseter muscles. And those people have extra forces on their teeth throughout the day and even at night when you're sleeping.
Yes, so in a perfect world, you would go throughout the day and your teeth would not be in collisions with each other. And as a matter of fact, even when you're eating, your teeth come to close collisions, but they're actually not touching intimately, right?
Yeah.
We all know that some people hold their stress in their jaw, and they're sitting on the road in traffic, late to go somewhere, and they're clenching their teeth, right? So keep in mind, you should keep your teeth apart the majority of the time.
Right. And we see with people who have clenching and grinding or a history of wearing down their teeth, the canines are a very important tooth. And very protective tooth in the mouth.
The canines. It always comes back to the canines. So once those canines are worn down, that's another reason for cracked tooth syndrome, because the canines are the guardrail of the back teeth, the guardrail. When those canines get flat, the back teeth do not like to have that lateral load on them. We talk about this all day long.
We do.
So a lot of times you can go back and build the canines back up, get your guardrails back up.
That's right, yeah. You'll see us have you move your jaw left and right. And what we're looking for is do you have canine guidance? Are those canines doing what they need to do?
There's a circuit breaker.
The circuit breaker, that's right. And what would be,
another one would be what we call our P2, our balance, right? So we're checking with the shim stock. If we see on this side, you've got one tooth hitting, and on this side here, you have 3, that one tooth over there, good luck. So we may want to talk about equilibrating.
Right, harmonizing your bite.
Harmonizing your bite, balancing and rotating.
Yeah, like balancing and rotating your tires.
Yeah, for sure. These are all things that you'll hear us talk about, and we're trying to avoid the cracked tooth. So I think that covers a lot of how to avoid it. I'm sure there's a couple more that we've left out, but you get the gist.
Right.
We've talked about ways to treat, which would be either watch or be preemptive, go in there and do a BioClear, or do a crown and a root canal, or potentially remove and do an implant, which would be the last option that we would use only if it's in your best interest to do that. We've talked about how to recognize it, the symptoms. Is there anything else?
No, that would be all. And if you feel like you have something like this going on, go to your dentist, have it looked at.
Yes, and we want to try to get you the most predictable outcome possible, and use your, as we said, emotional investment, your time that you're spending in the chair and money. As wisely as you can, because the goal is
get you to 100 with your teeth.
Correct.